Diseases affecting dogs. Canine Parvovirus. Symptoms include severe vomiting, diarrhea, often bloody, lethargy, loss of appetite, and dehydration. Transmission is highly contagious through contact with infected feces or contaminated environments. Treatment involves supportive care, including IV fluids, anti-nausea medication, and antibiotics to prevent secondary infections. Vaccination is highly effective in prevention. Canine Distemper. Symptoms include fever, nasal discharge, coughing, vomiting, diarrhea, and neurological signs such as seizures and muscle twitching. Transmission spreads through respiratory droplets from infected animals. Treatment involves supportive care, including fluids and medications to manage symptoms. Vaccination is the best prevention. Heartworm disease. Symptoms include coughing, exercise intolerance, weight loss, and in severe cases, heart failure. Transmission is through mosquitoes carrying the larvae of the heartworm parasite. Treatment involves medication to kill adult worms, usually an injection, and microfilariacide to clear circulating larvae. Preventive monthly heartworm pills or topical treatments are recommended. Kennel cough, also known as canine infectious tracheobronchitis, presents with a persistent dry cough, nasal discharge, and in some cases, a mild fever. It's highly contagious and spreads through respiratory droplets, especially in environments with high dog populations. Treatment often includes cough suppressants and antibiotics if a secondary bacterial infection is present. Vaccination can, reduce the severity of the disease. Lyme disease in dogs manifests with symptoms like fever, lameness due to joint pain, lethargy, and swollen lymph nodes. It's spread through tick bites, particularly from deer ticks. Treatment typically involves antibiotics such as doxycycline. Tick prevention through medications and regular checks is crucial to keep your pet safe. Now let's discuss diseases affecting cats. Feline leukemia virus, or FeLV, is a serious disease in cats. Symptoms include weight loss, poor coat condition, lethargy, recurring infections, and sometimes cancer. This virus is spread through close contact with infected saliva, blood, or other bodily fluids. Unfortunately, there is no cure for FeLV. Management focuses on supportive care and treating secondary infections. However, vaccination can prevent infection. Feline immunodeficiency virus, known as FIV, presents with symptoms such as chronic infections, weight loss, gingivitis, and behavioral changes. The primary mode of transmission is through bite wounds from infected cats. Similar to FeLV, there is no cure for FIV. Supportive care is essential to manage symptoms and prevent secondary infections. While there is a vaccination available, it is not universally recommended due to potential interference with diagnostic tests. Feline upper respiratory infections are quite common and can cause symptoms like sneezing, nasal discharge, coughing, and conjunctivitis. These infections are highly contagious and spread through direct contact with infected cats or contaminated objects. Treatment involves supportive care, including hydration, steam therapy, and sometimes antibiotics for secondary bacterial infections. Chronic kidney disease, or CKD. Symptoms include increased thirst and urination, weight loss, poor coat condition, and vomiting. It's not contagious and often related to aging or underlying health issues. Treatment typically involves a special diet, medications to manage symptoms, and sometimes fluid therapy. Diabetes mellitus. The symptoms are increased thirst, frequent urination, weight loss, and increased appetite. It's not contagious and is caused by factors including obesity, genetics, and pancreatic dysfunction. Treatment usually involves insulin injections, dietary changes, and regular monitoring of blood glucose levels. Diseases affecting both dogs and cats. Ear infections. Symptoms include scratching at the ears, shaking the head, a foul odor, redness, and discharge. Transmission isn't contagious. It's often caused by bacteria, yeast, or ear mites. Treatment involves ear cleaning, medications, and treating any underlying conditions. Obesity. Symptoms are excess weight, difficulty in movement, and an increased risk of related health issues like diabetes and joint problems. Transmission isn't contagious. It results from overeating, lack of exercise, or underlying health problems. Treatment focuses on weight management through diet and exercise and addressing any contributing health issues. Parasites including fleas, ticks, and worms. Symptoms: fleas cause itching and skin irritation. Ticks can cause anemia or transmit other diseases, and worms cause digestive upset and weight loss. Transmission: fleas and ticks are transmitted through contact with infested environments or other animals, while worms are often contracted from contaminated food or environments. Treatment includes flea and tick preventatives, deworming medications, and maintaining good hygiene and environmental control. Regular veterinary checkups and preventive care are essential for keeping pets healthy and managing or preventing these diseases. If you notice any symptoms or changes in your pet's health, consult your veterinarian promptly.